ourselves facing financial challenges that everybody knows about in our overspend, but also clinical challenges in terms of the number of staff, the doctors and nurses we have available to us, in terms of the need, the patient need that we have in this county now. People are happily, they're living longer, but they do develop more complex conditions. There are more complex treatments for that, and they need to be provided, the care needs to be provided. So we've got a situation of increasing need with increasingly constrained resources in terms of the money available and the staff available. The sum of all that means that we can't continue to work the way we used to because our situation is different, the challenges we're facing are different, and in order to protect the care that we offer patients, we need to adapt to our new situation, so we need to look at new ways of working. Yeah, I mean, as a county, there are things that make us different from the rest of the country. You know, our rurality, the size of our county, these are challenges that we face that might be different to other areas. But then, like a lot of other areas in the country, we have an ageing population. People are living longer, and when they live longer, they tend to develop more complex health needs which have to be met. And as I mentioned before, those health needs also spin into social care needs. If we don't have enough carers working in the community, then people are less able to maintain their independence, we're less able to discharge them in a timely manner, and that has a knock-on effect on the health systems. Yeah, I mean, the aim at heart is really straightforward. We want to make sure that there is safe, high-quality care for all the patients in Shropshire at the point they need it. The reason we need to have a review and to think about the way we're doing things is because, as we've said, we've got all these challenges facing us. Our situation is markedly different than it used to be, and we're probably going to have to do things differently in order to achieve that high quality care. What matters is that we do achieve it. The process by which we achieve it is less important than the fact that the patient gets their treatment, that they get their care. So long as we're achieving that, we as a CCG will be happy, and what we aim to do is actually improve those outcomes rather than simply maintain them. We want really good care for people, but we just need to be clever about how we're going about it. There are a number of areas that we've identified that because of financial constraints or staffing issues or because of changes in the way medicine's practiced, we're probably high up the list in terms of changes due. So what we're going to do is we're going to look at different areas, including things like orthopaedics, variation in prescribing, variation in emergency admissions. We're looking at the midwife-led units, community services in general. And for each of these areas, we're going to make sure that we have made sure that there is a named doctor for each review, there is a named commissioner for each review, it'll have its own independent timeline. And probably the most important thing to stress is that there's no prejudgment about the result of these reviews. We are gathering the evidence to see, can we do this differently? If the answer is the way we're doing it is actually the best way to do it, then that's what we'll do, because we're all about making sure that the care is really good. But we are in a pressured situation. We need to use our staff really wisely. We need to use our money really wisely. And so for each of these areas, we'll be looking to see, are we getting the best value out of these staff? Are we getting the best value out of the money we're spending? We want to make sure that patients get the care they need at the point they need it. We also want to make sure that we're not wasting these very, very valuable finite resources that we have, and that actually what we're doing is we're spending those pounds wisely, we're putting the staff where they're needed so that the patients, when they access their care, are getting really good care, are the best care that they can.